Have you ever wondered why you constantly have mucus in your throat? Surprisingly, this is an issue that affects millions worldwide, making everyday activities a challenge. Phlegm isn't just annoying, it can disrupt your sleep, affect how you talk and eat, and truly impact your quality of life. Today, we're diving deep into the reasons behind constant phlegm and mucus in your throat. Whether it's a persistent cough that won't go away or that uncomfortable feeling of something always being stuck in your throat, understanding the root causes is the first step toward relief. So, if you're tired of clearing your throat all day or waking up at night feeling like you need to cough, you're not alone. Let's explore what's really going on, and I'll share some essential insights on how to manage or potentially resolve this frustrating issue. Stay tuned as we uncover the 7 real causes of constant phlegm and mucus in your throat. It might just change your life. Number 1. Postnasal drip. Postnasal drip is a common condition where excess mucus accumulates in the back of the throat and nose. This occurs when the glands in your nose and throat produce mucus faster than it can be processed. While mucus is a normal and essential substance that helps moisturize these areas and trap foreign particles like dust and viruses, an excess can lead to discomfort and irritation. Several factors can trigger postnasal drip, including allergies, which cause the body to react to harmless substances as though they are dangerous invaders, leading to an overproduction of mucus. Sinus infections also contribute by inflaming and blocking the sinus passages, preventing mucus from draining normally. Even changes in weather, particularly cold or dry air, can thicken mucus or increase its production. The symptoms of postnasal drip include a persistent feeling of mucus at the back of the throat, which can lead to frequent throat clearing. This sensation may be especially noticeable during the night or first thing in the morning. It can also cause a cough that worsens at night when lying down, leading to sleep disturbances. Moreover, if not managed properly, postnasal drip can lead to other complications like sore throat, hoarseness, and even an ear infection if the mucus backs up into the eustachian tubes. Understanding the underlying cause of postnasal drip is crucial for effective management, which may involve treating allergies, addressing sinus infections, or simply adapting to environmental changes. This insight into your symptoms can provide relief and improve your quality of life significantly. Number 2. Chronic rhinitis. Chronic rhinitis is a persistent inflammation of the nasal passages that can significantly disrupt daily activities and overall well-being. It's categorized mainly into 2 types, allergic rhinitis and non-allergic rhinitis, each triggered by different factors but resulting in similar troublesome symptoms. Allergic rhinitis is more common and occurs when the immune system overreacts to airborne allergens such as pollen, dust mites, or pet dander. This immune response triggers the release of histamine and other chemicals, causing inflammation and symptoms such as a runny nose, sneezing, and congestion. Non-allergic rhinitis, on the other hand, does not involve the immune system. It is often triggered by environmental factors such as smoke, pollution, strong odors, or changes in the weather. In some cases, it may also be caused by medications or underlying health issues. Unlike allergic rhinitis, it's characterized by a constant stuffiness and mucus production rather than itchy, watery eyes or seasonal variation in symptoms. Both forms of chronic rhinitis typically present with a persistent runny nose, frequent sneezing, and a bothersome postnasal drip that contributes to throat mucus, leading to throat clearing and coughing. This condition can complicate into sinus infections or contribute to other respiratory issues if the mucus obstructs proper airflow or drainage. Understanding whether rhinitis is allergic or non-allergic is crucial for effective treatment, which may include avoiding known triggers, using appropriate medications like antihistamines or nasal sprays, and in some cases, undergoing allergy testing and immunotherapy. Managing chronic rhinitis effectively can help alleviate symptoms and improve quality of life. Number 3. Gastroesophageal reflux disease, GERD. Gastroesophageal reflux disease, GERD, is a digestive disorder where stomach acid frequently flows back into the esophagus, the tube connecting the mouth and stomach. This backwash, acid reflux, can irritate the lining of the esophagus, leading to a range of uncomfortable and potentially severe symptoms. The primary symptom of GERD is heartburn, a burning sensation in the chest that often occurs after eating, lying down, or at night. This discomfort may seem like it's coming from the heart, but it's actually centered in the lower chest and is a direct result of stomach acid washing up into the esophagus where it doesn't belong. Besides heartburn, people with GERD commonly experience a sour or bitter taste in the mouth, especially upon waking up or after meals. This is due to acid reaching the throat and mouth. Other symptoms include frequent throat clearing and a persistent cough, which are reflex actions to clear the throat from the irritating stomach acids. These symptoms can be exacerbated when one lies down or bends over, making nighttime particularly troubling for individuals suffering from GERD. GERD is not only uncomfortable but can lead to more serious health issues if left untreated, including esophageal stricture, Barrett's esophagus, and even esophageal cancer. Management typically involves lifestyle changes such as modifying diet, reducing alcohol consumption, quitting smoking, and losing weight. Over-the-counter antacids can provide quick relief, but for ongoing management, stronger medications like proton pump inhibitors or H2 blockers may be necessary. In severe cases, surgical interventions might be considered to strengthen the lower esophageal sphincter and prevent reflux. Number 4. Respiratory tract infections. Respiratory tract infections, RTIs, encompass a range of infectious diseases that affect the airways and lungs, including the common cold, influenza, flu, and COVID-19. These infections are primarily caused by viruses, although bacteria can also be responsible in some cases. The respiratory tract's main defense against these pathogens is to increase mucus production, which helps trap and eliminate the invaders. The common cold, typically caused by rhinoviruses, manifests with symptoms such as a runny nose, cough, and congestion. Influenza, caused by the flu virus, presents more severe symptoms, including high fever, muscle aches, severe fatigue, and a more intense cough. COVID-19, caused by the novel coronavirus SARS-CoV-2, can range from mild symptoms similar to the common cold to severe respiratory distress and multi-organ dysfunction, depending on the individual's immune response and health status. All these infections share common features like coughing and increased mucus production, which are the body's natural responses to clear the airways of both the pathogen and the debris produced during the immune battle. Other general symptoms include sore throat, sneezing, and in more severe cases, difficulty breathing and chest pain. Preventive measures for RTIs include good hygiene practices like frequent hand washing, wearing masks, and vaccinations where available, such as for flu and COVID-19. Treatment largely depends on the severity and type of infection. While mild cases may resolve with rest and fluids, more severe infections might require antiviral medications, antibiotics, if bacterial, and sometimes hospitalization. Understanding these infections and their impact on the body is crucial for effective management and prevention of more serious complications. Number 5. Smoking and tobacco use. Smoking and the use of tobacco products are among the leading causes of preventable diseases and death globally. When you smoke, you inhale a variety of harmful chemicals, including nicotine, tar, carbon monoxide, and other toxins, which directly affect the respiratory system. One of the primary impacts of smoking is the irritation of the mucous membranes lining the respiratory tract. This irritation prompts an increase in mucus production as the body attempts to protect and repair the inflamed tissues. The tar and other particulates in tobacco smoke contribute to this effect by sticking to the lining of the airways, further aggravating the mucous membranes and stimulating excessive mucus secretion. The symptoms associated with smoking are often progressive and detrimental. A chronic cough, often referred to as smoker's cough, develops as the body's way to clear out the excess mucus and toxins from the lungs and airways. This cough can be persistent and painful, and it often worsens in the morning after a night's accumulation of mucus. Additionally, smokers frequently experience increased phlegm production, which can be thick and difficult to expel, leading to significant discomfort and breathing difficulties. Over time, continued smoking can lead to more severe respiratory conditions such as chronic bronchitis, emphysema, and COPD, chronic obstructive pulmonary disease, all of which further exacerbate the problem of excess mucus and compromised lung function. Quitting smoking is essential to reduce these risks and improve overall respiratory health, though recovery can vary depending on the duration and intensity of tobacco use. Number 6. Medications. Certain medications, while essential for managing various health conditions, can have side effects that impact the respiratory system, notably causing cough and increased mucus production. A prime example of such medications are ACE inhibitors, commonly prescribed to treat high blood pressure and heart failure. ACE inhibitors work by blocking the action of a hormone called angiotensin-converting enzyme, which helps regulate blood pressure by constricting blood vessels. While effective for lowering blood pressure, these medications can affect the respiratory system by accumulating substances that irritate the cough receptors in the airway. This irritation can lead to a persistent, dry cough and an increase in throat mucus, which can be particularly frustrating for patients. This dry cough is not typically accompanied by other symptoms of respiratory illness like fever or wheezing, making it somewhat unique to this medication side effect. The increase in throat mucus is also a direct result of the cough reflex being triggered more frequently, as the body attempts to soothe the irritation in the throat and airways. Number 7. Chronic bronchitis. Chronic bronchitis is a serious respiratory condition that falls under the umbrella of chronic obstructive pulmonary disease, COPD. It is characterized by the inflammation of the bronchi, the large and medium-sized airways in the lungs. This inflammation leads to the production of excessive mucus which, unlike normal mucus that serves to trap irritants and microbes, significantly obstructs air passages and contributes to difficulty in breathing. The primary symptom of chronic bronchitis is a persistent, productive cough that brings up thick, often discolored mucus. This cough is not just occasional, it lasts for at least 3 months and recurs for 2 consecutive years, distinguishing it from temporary respiratory conditions. Individuals with chronic bronchitis also frequently experience shortness of breath, particularly during physical activities, as the disease progresses and the airways become increasingly constricted. Chronic bronchitis can lead to frequent respiratory infections. With the airways constantly inflamed and filled with mucus, they become more susceptible to bacterial and viral infections. Each new infection exacerbates the condition, creating a vicious cycle of worsening symptoms. The development of chronic bronchitis is most often linked to long-term exposure to irritants that damage the lungs and airways. Smoking is the most common cause, but exposure to air pollution, dust, and toxic gases can also contribute to the onset of this condition. Management of chronic bronchitis involves quitting smoking, using bronchodilators to ease breathing, engaging in pulmonary rehabilitation, and getting vaccinations to prevent respiratory infections. In wrapping up, if you're experiencing persistent symptoms like constant phlegm, coughing, or throat irritation, it's crucial not to ignore what your body is trying to tell you. These signs can be your body's way of alerting you to underlying health issues that need attention. I strongly encourage you to consult with a healthcare provider to get a proper diagnosis and appropriate treatment. Managing these symptoms effectively can significantly improve your quality of life. If you found this information helpful, please give us a like, subscribe for more insightful health content, and share your thoughts or experiences in the comments below. Your interaction helps us reach more people and continue providing valuable health insights. Remember, taking early action can make all the difference. Stay healthy and informed.